Good morning and welcome to the Nevada Caregivers Coalition's first Conversations with Caregivers. The coalition works to create community awareness and to change public policy on the issues facing all caregivers and their families. I am Mary Liverati, and I'm your host this morning. I'm a member of the Nevada Caregivers Coalition. We are a group of organizations, agencies, businesses, and individuals who provide care to individuals and loved ones across the lifespan. Every November, in celebration of National Family Caregiving Month, we host a recognition event for Nevada caregivers. The Nevada Caregiver Coalition has a website that we encourage you to visit at nevadacaregiverscoalition.com. On the website, you will find our blog, a calendar of events each month, and how to join our monthly meetings. We also have a Facebook page and encourage you to check it out. We meet on the second Wednesday of each month from 11:30 a.m. to 1 o'clock p.m. We meet on Zoom for the time being. Hopefully we'll be meeting in person at the end of the year, but we discuss current issues facing caregivers. Members receive Zoom instructions each month. If you're not a member, which we encourage you to join us by sending your information on our contact form, which is available on our website. We are so pleased that you have joined us this morning. And this is a brand new venture for us, so please bear with us as we get started. I hope I don't forget any of the many notes I'm supposed to say this morning. So anyways, this is a monthly forum for caregivers to gain information and to share their concerns with us. We invite you to share topics that are of interest to you for future sessions in the chat feature during our conversation today. Today's topic is how to access the COVID-19 vaccine. A few reminders on Zoom etiquette before we start. First of all, I'd like to remind those of you that might like to have to read a transcript as we go through this morning's session that there's a button at the bottom of your screen that you can click on that says live transcript is available. So you will see that. Oh, sorry, I see somebody that's waiting to get in the room. I'm going to admit them. There we go. So please use that feature if that makes you more comfortable. We also request that you mute your microphone unless you're asking questions. We'll have questions after each speaker concludes their remarks. If you have a question, you can raise your hand or you may use the chat feature to ask questions or comments. When you are recognized to ask your question, then you can turn your speaker on. Thank you. Well, we're very lucky to have our speakers, two great speakers this morning. With us today are Aaliyah Goodie, who is the COVID-19 vaccine project manager at Immunize, Nevada, and Dave Nichols, a care consultant and lead case manager for Nevada Senior Services Care Connection Resource Center. To get started today, we would like to know how many of you are planning to get vaccinated or already have. So we have a poll question for you to answer. You should see the poll on your screen. And if you go ahead now and just vote, we will see what the results are. Oh, wow. I'm impressed with the number that are vaccinated already. Wow. Fantastic. Geez, and it's going up. That's amazing. 77, 79%. Wow. Wow. And let's see. So we have nobody saying no, nobody that's undecided. Everybody, wow. 100% either says yes or is going to be or is already vaccinated. So congratulations, Nevadans. Wow. I am very impressed. Okay. Well, let's get started with our speaker. First, we are so pleased that Aaliyah and David have joined us today. They are very busy all the time, but especially since the pandemic has hit us. We're going to start today with Aaliyah, who is helping to assist with the rollout of the COVID-19 vaccine. Aaliyah works with Immunize Nevada, which is widely recognized as Nevada's trusted resource for immunizations and community health for all ages, by fostering education and statewide collaboration. Their vision is to foster healthy communities across Nevada protected from vaccine preventable disease. Today, she will discuss ways to make COVID vaccine appointments with and without internet access and how to find resources. So we're hoping that even if you have your vaccine, if you know somebody that's having difficulty making an appointment, some of this information today may help you assist maybe a neighbor or a friend or a loved one. So go ahead, Aaliyah.
Thanks, Mary. Good morning, everyone. Happy to be here with you all today. Thank you for that introduction, Mary. I, of course, Immunize Nevada. Our main goal and focus is to make sure to push out those immunizations for all ages throughout our state. And of course, with the new rollout of the COVID-19 vaccine, that has been one of our main focus and priorities right now. So very happy to share with you all some information and resources about how to make appointments, where you can find more information, and then also happy to answer any other COVID-19 vaccine related questions. So I am gonna very quickly share my screen with you all just to give you all a visual. And let me know if you can see that okay. Okay, perfect, thanks Marcia. So this is our mvcovidfighter.org website. And so it will pull you to the Immunize Nevada website specifically in order to see this page with just all of the COVID-19 vaccine information in general that we host on our website. And so one of the first things I really wanted to show you all, so if you kind of hover over this drop down here, you'll get a few different options for COVID-19 vaccine resources, but I really wanted to show you all this county specific vaccine plan page first. And so if you click on that page, it will bring you here for the county specific COVID-19 vaccine distribution. So as the vaccine is kind of being rolled out, each county kind of heads over their specific rollout plan. And so not all counties may be in the same place currently about who they're vaccinating or where they're vaccinating. And so this plan was really created for all Nevadans to be able to have a hub and a place to find information that is not only specific to Nevada, but is also specific to the county you're currently living in. And so if I scroll down just a little bit here, and for instance, just for the sake, and I click Clark County, this tab will give you all of the current places where Clark County is vaccinating, but will also give you information about pharmacies and their vaccination programs and how to schedule appointments with the pharmacies. And then we'll also let you know currently, if you scroll down a little further, who is currently eligible specifically in that county to be vaccinated. And so this page really will give you the most information and will be the most helpful, especially county-wise, in finding where you can be vaccinated, who's vaccinating right now. We work directly with the counties to update this page. So this information comes directly from the county specifically in order to really be a hub for all Nevadans to find actively updated information, but also information that is correct for you all. One of the other things I wanted to make note of on this page as well, and so for those who may not have great access to internet, or in general, I think one of the things we've really been talking about is just that technology divide of all of the appointments, a lot of the times being online, and folk having just difficulties in utilizing online to make appointments. And so the state actually created a hotline number that is open 8 a.m. to 8 p.m. 7 days a week for Nevadans to call in order to get assistance in making appointments to get the COVID-19 vaccine. And so those who are on the hotline who answered your call will not only help you find where appointments are if you need that help, they can also assist with making appointments, letting you know if you're currently eligible for an appointment, and any of your other COVID-19 vaccine related questions. And so I also did want to mention with this hotline, it is available in both English and Spanish. And so if you are in need of another language for some information, they also offer that as well. And so this is really for those who may not have great access to utilizing the internet to make appointments. This hotline will really assist you with all of your needs in that area. And then just for the sake, if someone's on a phone and can't see my screen, the number is 1-800-401-0946. And so in addition to this page, I did also want to show you all this vaccine locator. And so one of the things I think we really understood was having just a big hub of where you can find vaccine and kind of utilizing your zip code to find the closest vaccine place near you. And so we actually put together this COVID-19 vaccine locator also on our website, and you can also find it on this COVID-19 vaccine drop down here where it says vaccine locator. And so what we've been trying to do is, so all of the pharmacies are listed in this locator. So if you're looking for a pharmacy to get vaccinated, you can very easily find it here. And then one of the other things we've been trying to add is this community site tab. And so for community sites who are regularly vaccinating folk weekly, and it's not just a pop-up clinic, we've been trying to add it also on here just because if it's going on daily and weekly and it's a reoccurring place for you to get vaccine, that'll also be listed on here. And so just for the sake of demonstration, my zip code is 89128. So if I pop in my zip code, for instance, and then as it loads, it'll pull up all of the nearest locations to me on this left-hand side. So pharmacy, CVS, outreach clinics, health centers, anything to that degree. And we'll also give you just some directions on how to get there. And so in combination with this page and then that county page as well, I believe these are going to be the best resources to utilize to find accurate information on not only where to make your appointment, but currently what the eligibility looks like for appointments as well, and then also utilizing that call center line. And so I will go ahead and stop sharing my screen and happy to answer any questions that may have come up while I was talking.
Thank you, Aaliyah. That's great information for us to have. Do we have anybody that has a question? If you do, please raise your hand and Marcia will acknowledge you, and then you'll unmute yourself to share with everyone. Or use the chat feature if you have a question or a comment even that you want to make. We're happy to hear from you.
Deanna has a question. Deanna, go ahead and unmute yourself.
So my question, Aaliyah, is about this business of Tylenol. I've heard some comments that there's some concern about taking Tylenol before you get the shot. Is that correct information or not?
Yes. So I am going to heavily lean on the reliance of our neighborhood physician, Pam Forrest, who works with the state. And so her guidance is before you go to take the COVID-19 vaccine. So what you don't want to do is take Tylenol before you go in anticipation for pain, because that will weaken your immune response before you get your vaccine. And with the vaccine, you want the strongest immune response you can get. And so your body builds up that immunity to COVID-19. After your vaccination happens and you end up with headache, pain at the injection site, things like that, you can take Tylenol and ibuprofen to alleviate that pain. So really the recommendation right now is before you go in to get your vaccine, not to take Tylenol, ibuprofen, aspirin, but afterwards, if you feel pain at the injection site, you don't feel well, you can take pain meds after.
Great, thank you.
And we have a question in the chat from Cheryl Donnell. Cheryl, do you want to unmute yourself and ask it directly?
I was just asking about the process of getting an appointment. I'm hearing that if you go through a pharmacy, that you've got to go through that pharmacy's scheduling process, and that there are different scheduling processes for each one. And I'm wondering if this new 1-800 number, the hotline, will help actually get somebody scheduled for a vaccine.
Yeah, so that 1-800 number, they can help schedule the vaccine. And one of the things we've been in conversation, especially with the Board of Pharmacy, about is that barrier between needing an email address to make appointments at times, and things like that. So if you don't have internet access, a lot of the times you don't have an email address, and so how do you make that appointment? And so some of the pharmacies have been pulling off that requirement, so you don't need an email anymore. But regardless, if you call that 1-800 number, they will be able to assist you to get that appointment, kind of regardless. And so just a little bit more to your question, all of the pharmacies each have their own scheduling system for the vaccine. And then the community sites also most often will have their own scheduling site. So if you, for instance, want to make an appointment at a Smith's, it is one Smith's website per se to like make an appointment. It's just choosing the right location. The only time I think the link will really differ if it's a community site. The difference between those, a lot of the times the link for making appointments will be different. So yeah.
Okay, so Aaliyah, we have another question from Heidi Howe. Heidi, you want to unmute yourself and ask it directly? It's a great one.
Hello, can everybody hear me? My question is, as a family caregiver, how do we qualify to get the vaccine? Because I'm in that wonderful zone of where I'm not old enough and I don't have underlying conditions, but I am caring for a 92 and an 86-year-old. I did get them in for their vaccinations, and I know that they're going to be opening it up to everybody according to the governor on April 5th, but I'm still curious if there is a way for family caregivers to be looked at in the same way as a paid professional caregiver.
Yeah, so my understanding, based on the state's playbook, you would technically have to wait until it was your time to be vaccinated. So whether that's based on occupational category, or if it's based on your specific age. I have, which I recognize that has been super frustrating. I think for a lot of different groups, even in the occupational kind of lane. But just passing on the information that it is just about to open up, at least on the pharmacy side, to all Nevadans. So all Nevadans will be able to make an appointment at the pharmacy as long as you're 16 and older. And then I know next week kind of starts that 16 to 54 with underlying health conditions. So yeah, I think, yeah, that's kind of been the recommendation, that it's just really going to be based on eligibility, personal to yourself.
Thank you.
Great question. We've got a couple more in the chat here now. We have one from Jimmy Collins. Do you want to unmute yourself, Jimmy, and ask it directly? Jimmy, you're welcome to unmute yourself and ask the question.
Okay,
Yeah.
now can you hear me?
Yes.
Okay, so it's really Mary Beth Collins. I don't know how to take my kid's name off Zoom. I had the same question as the last person. The fact that us caregivers didn't get prioritized like they did in California is insanely frustrating to me, because I am really certain Renown would not have enjoyed me dropping off my sick kid in the ER on my way to the ER, because that's what would have happened. But so now I'm eligible on April 5th. Am I actually going to be able to make an appointment? Is there really enough vaccine to go around, or am I going to spend the next month day in and day out on all these websites, cycling through websites, trying to even get an appointment? I mean, it's one thing to say I can, it's another thing for there to be an appointment for me.
I'm going to answer this as best as I can, just because I think with everything opening up, of course, nothing is for certain, but through the governor and his talks with the White House and the current administration, they are anticipating having enough vaccine to be able to serve all Nevadans. And so the governor's kind of thought process, I think, behind that was to really start opening up the lanes with the incoming increase in the allocation for the COVID-19 vaccine. And so there is, I guess my recommendation would be to just make sure to keep checking for appointments and things like that. I know sometimes what happens is appointments are uploaded during certain times of the day. And I wish I could tell you for all of them when they add their appointments and things like that, but they upload them as they know their allocation. But the word on the street per se out there is that there will be enough vaccine in order to get vaccinated. It's really just gonna really be keeping an eye on those appointments, I think.
Well, it looks like those are the only questions we've had in the chat. Does anyone else have a question that you didn't type in yet, but you'd like to have answered before we move forward? Okay.
Hi, Marcia and Mary. This is Marta Malone.
Yes.
Hi, everyone. So I just wanted to give you guys a tip. It was quite a process, but I was able to get both my vaccines with the leftovers at Walgreens. So it's kind of something that's not really advertised or anything, but if Walgreens has any leftovers at the end of the day, like if somebody didn't show up for their appointment, or maybe they had to open one of the vials at the end and they have some left in that vial, instead of throwing it away, they give it to people. They were going around the store and asking if anybody in the store was interested in getting vaccinated. And anyway, so it was kind of a pain. I made a list off of the website for all of the Walgreens in the area and just started calling between 4 and 8 in the afternoon. And on the second day that I did that, I actually got a hit. And they said, "Can you get down here right away?" And I said, "Absolutely." So you have to be willing to, kind of drop everything and go. So I got my first one, and then they don't schedule your second vaccine at that time. And so it's a little bit of the same process, but I did get a call from Walgreens saying that it was time. And so I called them and they put me on a waiting list. And yesterday was my day 28. And they called and said, "We had a cancellation this morning. Can you get down here within the next half an hour?" And I said, "Absolutely." And I went down there and got my second dose. So it's a little hit and miss. It's some work to do it. But if you're really dedicated and you really want that shot like me, I felt like it was worth it. And yay, I'm vaccinated. 14 days. Thank you.
Thanks, Marta. Yeah, some, and we just haven't been publicizing because it's not really across the board. Some sites do have waiting lists that they hold for those who maybe like call and may not be eligible and kind of want to get on a list per se. But yeah, it's not across the board at all pharmacies and not at all sites. And so really, I think probably the best method would be to just call the specific pharmacy you're gonna go to and see if they have a waiting list or not.
This is Mary. I would just say that if you're able to get to one of those drugstores, I'm like Marta, it was a fluke. We went in because we couldn't get scheduled to talk to them about the scheduling. And they said, "Do you want a shot? We'll give it to you right now." We were there at 4:30 in the afternoon. But they said we'd have to be willing. I'm in Carson City. I'd have to be willing to go to Reno for my second shot. Well, as it turned out, they called us and had us come over to the Carson City store to get our second shot. So I feel like I got it in on a fluke just trying to get information. So if you're in the store, always ask them. Go to the pharmacy and ask them if you're there anyway. So Cheryl, you've got a good question in the chat. I just noticed that. Is there any reason to shop for site that has a certain vaccine, such as 1 dose versus 2 doses?
No. So my answer to that would be no, just because our kind of like recommendation now is all of the vaccines are good vaccine. They all have really good percentages of protecting you from severe to moderate illness of COVID-19 vaccine. And so, yeah, they're all good vaccines, regardless of what the pharmacy has or what a site may have that day. Just encouraging you, if you can get a vaccine for any of them, to just go ahead.
I'm just wondering, you know, my father-in-law just died 2 weeks ago, but he was 94, had a stroke, and we didn't get him vaccinated because trying to get him out and getting it. I'm wondering if maybe if he was able to get out to do it, we probably would have looked for a 1-shot site just so we didn't have to drag him out twice, you know. So that might be a consideration for somebody that has a loved one that isn't as mobile as some of us. So that would be the only thing I was thinking maybe might be a consideration. But it's good to know they're all good efficacy, or whatever the right scientific term is. They're going to work. So just get out and get those vaccines. I don't see any more. Marcia, do we see any more hands for Aaliyah?
No, I think we're ready to move on.
Okay, do we want to do our second question?
Yes.
Okay, well then we do have another poll question for everybody. So our question, now that you've heard Aaliyah and what she's all told us, how confident are you to get an appointment? So those of you that haven't gotten an appointment yet, or somebody that's looking for an appointment for a loved one that you're trying to get it. Oh, I didn't realize we also have I don't need one because I'm already vaccinated. Okay, well, that's a good option for some of us. Okay, let's see. Well, I see that we've got a few people that are not very confident. Actually, only one person. I was looking at the percentages, 7%. Somewhat confident, 20%, and 13% are very confident. So we're going to provide some more information with our next speaker. And I think that we will hope that David might be able to answer some questions people have. And we're going to move on right now so that we can hear from him. So I'm really pleased to welcome David. We're going to hear David Nichols, who has worked in social services for 8 years, including the following areas: veterans, homeless, mental health, and juveniles. He works for Nevada Senior Services, which is a nonprofit organization dedicated to improving the physical, spiritual, and emotional health of individuals and families by providing a comprehensive range of health, education, and social services for those facing the challenges of chronic disease, disability, and aging. Today, he will be sharing information about COVID-19 resources. Go ahead, David.
Good morning, everybody. I am very excited to be here today, and I thank you all for allowing me to come and speak today. It kind of hits home with me in reference to this topic. I am currently the president of the Nevada Lifespan and Respite Care Coalition. So it's very important for me to address my caregivers and provide information, as much information possible to my caregivers so they can be empowered as much as possible. So it's it kind of works out perfectly that I was invited by the Caregivers Coalition to speak with you guys today. So I'm very excited about that. And from a coalition standpoint, what the NLRCC has been doing is we've been trying to work on in terms of just being active in getting the information out. I'm going to share one of our website real quick. Give me 1 second. Are you guys able to see? So with the NLRCC, what we've been doing is, being that we're caregiver driven, we've been trying to compile a list of information, both providing information about COVID-19, how to, where to get vaccinated and things like that. We've also been working really hand in hand with the Care Connection resource centers in both the North and the South. So a lot of our members from the NLRCC are going to be, if you're asking somebody from the NLRCC, you're going to hear a lot of referrals to the Nevada Care Connection Resource Center. In the North, a lot of times we've been referring to access to healthcare, and in the South, it's been the Care Connection Resource Center. So one of the big things that we have been able to provide to assist with getting connected to the vaccination is resource service navigation. So in the South, resource service navigation is when an individual is able to kind of walk with you hand in hand to obtain certain resources that you're in need of. What we've been doing in reference to the COVID-19 vaccination is our resource service navigators have been able to be very active in the process of assisting with getting appointments. Just like what was mentioned earlier, a lot of our caregivers are not so techno savvy. Also, there's been barriers where there's been issues with running into the hotlines. Our resource service navigators are able to kind of get out to these individuals, whether it's in their home or over the phone, to kind of assist with bridging that gap for the process. So we've actually had our navigators that have been able to help individuals set up email addresses and things like that when that was one of the barriers. We've also had individuals sit on the phone with our caregivers and our care recipients while we're walking through that process. At the beginning, we were not allowed to press that button to, set the appointment. So we had to do a lot of getting out to the homes and kind of doing that with them. So on the resource service navigation side, we've been able to kind of act as some hands and feet to kind of bridge some of those gaps for our seniors and our caregivers. In terms of Nevada Senior Services, the Care Connection Resource Center is filtered through to the Nevada Senior Services, who usually will take the calls. We're operating and we're addressing both seniors and individuals of a lifespan. And with Nevada Senior Services, that's where you'll find the resource service navigation. Additionally to that, our CEO, Jeff Klein, has been very pivotal in our advocacy efforts, both for Southern Nevada and the overall state of Nevada. We've worked a lot with AARP, Immunize Nevada. We're on the cause for the COVID-19 vaccination task force. So we just been doing a lot of advocacy, pushing for a lot of the push has been for our homebound seniors and our seniors that have been experiencing social isolation. So we've been trying to act as the voice to try to get the word out, get the need out. Our organization has made a lot of moaning and groaning to Aaliyah. It talks about, what the barriers have been, and she's been excellent in receiving our critiques and providing us options to help with a solution. The solution is not here all the way. It's still very difficult, as you guys have all expressed, to get to the vaccination and things like that. So what we've been doing as an organization and as a coalition is just trying to smooth that out with providing as much information as possible. So our navigators have been able to kind of help reach out to places like the UNLV school, UMC, the health department, Walgreens, Smiths, all those that you already know. We've been kind of acting as an additional hand, an additional ear to get that word out, get the calls in so that we can get individuals vaccinated with these appointments. Additionally, through our collaborations that we've been able to do, through our advocacy, just being that squeaky wheel, because we all know the squeaky wheel is the only one that gets the oil. So being those loudmouths, from advocating, we've been able to make connections that have actually allowed us to get a little bit closer to provide better connecting our caregivers and our care recipients. So 2 weeks ago, we had our first pop-up clinic at Nevada Senior Services, where we were able to provide assistance vaccinations. It was the Moderna vaccination. We were able to provide vaccination to 100 seniors on that day. So individuals that have been in contact with Nevada Senior Services, both caregivers, care receivers, individuals that have been 65 and up, we were able to get them their first shots. And next month, we'll definitely be following up for the second shots. And that was only due to our efforts in reference to advocacy and being willing to engage and connect and collaborate with all these different organizations that have been in the efforts with the COVID-19 vaccinations. So the first one was we were able to get students from the Toro Center that were able to come out and help, and it was an awesome event. A lot of information was getting passed out and things like that. So we were very excited about that. Earlier this week as well, we were actually able to provide assistance and get 60 individuals 65 and under that were coping, either caregivers or were coping with a disability. We were able to do another pop-up clinic, and that was with the help of the Albertsons pharmacies, where they were able to come out. And on that case, we were able to get about 65 individuals vaccinated at that point. And that was also a Moderna shot. And next month, we're looking at having our 2 follow-up shots. And that's just one attest to our ability that we've been successful with our outreach, our resource connection. And it's not just us, it's all of our organizations. It's all of you all being voiceful. You know, the need has been determined. The need is seen now. And what we've been able to do is we've been lucky on 2 occasions to get this Moderna shot. And we're going to be moving forward to try to assist with getting more pop-up sites as well at Nevada Senior Services. So in terms of overall, as far as getting connected, resource service navigation through the Care Connection Resource Center and also through the access to healthcare have been very big pivotal things that have been helpful with getting people connected. So that's really the biggest thing that we've been working on. One of the big portions, another portion that we haven't yet been able to tackle has been the homebound seniors, both individuals that are caring for homebound seniors or those seniors that are living by themselves. It's been an extremely scary situation for them, and I do understand that. And we do empathize, and we have not, overlooked that. So one of the things that we're doing in the South, it's not anywhere near fruition. It's not there yet. However, we've been working with individuals to kind of include individuals that have been providing services with home delivered meals. So we have programs like Delivering with Dignity and Meals on Wheels. And they have volunteers and staff that are going out to the homes weekly. And they're hearing these stories about individuals that are wanting to get vaccinated, that don't know how, and also that can't get out. So one of the things we're wanting to do, it's not here yet, but we're definitely working on it. Our CEO, Jeff Klein, has been extremely big on this, is we're trying to get a situation where we can get these volunteers that are going out to the homes to deliver meals. We're wanting to get, our idea is wanting to get them trained in how to give sticks in reference to providing homebound seniors with the vaccination. So it's not here yet, and just continue to go on our website, nevadaseniorservices.org. But that's one of the solutions that we're looking at trying to employ. So once again, the advocacy and engagement and collaboration are the only ways that we're going to be able to get this done. So, we'll definitely be working with Aaliyah and everybody else to try to make this vaccination a lot more attainable to the overall crowd. Because just as you guys said, just because it's open to everybody doesn't mean it's accessible to everybody. So what we're trying to do is we've gotten to a point where we've made availability, where we made access a little bit better, but now we're trying to get it to the point now where individuals are able to actually get to it. So it's still a work in process. However, just bear with us. Continue to please funnel your barriers, successes, and needs, and we'll definitely continue to advocate and engage our communities as well to address this. And that's all I have for today. I thank you guys so much.
Well, thank you, David, for sharing this information with us. I don't see any questions in the chat. I do see a lot of really good information going on in the chat. Deanna, I see your hand up. Would you like to ask a question or make a comment?
I would like to ask a question. So, David, thank you for that information. Can you tell me, are you running into many seniors who are really leery of getting the vaccine, or are you mainly just dealing ones who definitely want it?
To be honest with you, there's been a mixture of both. At the beginning, when the vaccine came out, there were a number of individuals that were leery about it. Everybody kind of got the horror stories about the side effects that were following after. So my caregivers, I'm actually a care consultant with Nevada Senior Services. So that is what I do on a day-to-day. So on a daily basis, I was hearing individuals that were leery about receiving the vaccination. After ongoing vaccinations have been occurring, information has been getting out. People that have been receiving the sticks already have been going on boards. They've been letting people know their experiences. And I've been noticing a lot more individuals have been open, and caregivers as well, for both themselves and for their care receivers to get the shot. One, I think overall, it's just people are feeling that it's time. It's difficult now to go to your doctor. It's difficult to go to the store. Individuals are scared and they're tired of living in fear. And the information that's been coming out in reference to the vaccinations have been very good with helping people get a little bit of hope that maybe if I do get this shot, there may be a light at the end of that tunnel. So initially, yes, a whole slew of my caregivers and care receivers were very leery about getting it. However, I am seeing a large shift to individuals that they're still a little bit leery. However, they're seeing the benefits of the possible benefits of receiving the vaccination.
Well, that's good news. I'm glad to hear that. Thank you so much.
Marcia, do we see any other hands?
Yeah, well, we've got a couple. I just wanted to summarize some of the comments here. And I wondered if Kaylee might want to elaborate a little bit on transportation support up here in Northern Nevada. We've talked about some in-home options a little bit, but I know there are a couple of programs up here in Northern Nevada that are actually operational at the moment. And let's see, where was it? The possibility of using EMTs and first responders to make house calls. You know, has that been anything that you've had experience with, David?
It hasn't been anything I've had personal experience with. However, we have been reaching out to our first responders. I believe in part of the plan in reference to getting trainings done for our volunteers that are going out giving the meals. Definitely our doctors and our EMTs, first responders, are going to be a part of we're looking at them to be a part of that training process, so that we can. One of the things that I do know has been not a barrier, but with our first responders or EMTs, they're already extremely busy. They have a very huge job that they're doing on a day-to-day basis. And just getting, having to kind of delegate that line of work has been, that's one thing that we're always going to be conscious of, because we don't want to take away from the EMTs from their job that they're already providing to provide the sticks. However, that has been in the plan. To work with them in reference to training. We do know that they'd be willing to assist when it is needed. So it's all still coming into planning and collaboration. So I don't have any direct line of contact with the EMTs as of now in terms of them providing the vaccination. However, they are in a pivotal part of the plan in reference to training. And I'm pretty sure that they definitely will be helping to get that out, as they can. However, we do want to make sure that they're available for their primary job, which is, to kind of reduce and mitigate individuals that are going through any type of emergency.
Of course. Well, thank you, David. We do have another question from Kathy Doyle. She just raised her hand. Kathy, you want to unmute yourself?
Hi, everybody. I'm Kathy Doyle. I'm a parent advocate. I've heard on TV commercials and so forth that the RTC here in Northern Nevada are giving the rides to the, I guess it's the Livestock Advance Center, as long as you have a printout of your your appointment time, and they give you a ride to and from. I believe you need to call RTC to make the connection with that. And so that's all I know for right now.
Thanks, Kathy. Yes, Kaylee shared in the chat details about how to call and how to connect with that. Kaylee, do you want to talk about that for just a minute and share with people who might not be able to view their chat?
Sure, and sorry for all the multiple messages, but it was too large of an email to do in one. So those are just some in the Reno Washoe area transportation options for those who may not be otherwise able to drive to an appointment. So there's a few companies you can work with to make that happen. I'm not myself involved per se, but just as Washoe County employee, was just sharing the info for those who it may apply to.
I will add that on the news last night, they said that you could show them your text appointment, your appointment on the RTC, either through your phone, your text, or a printout that you would bring. So that's great to hear that we're getting some transportation services.
Yes, and on the Southern Nevada side, I have heard stories about MTM being assistance in helping individuals get to these vaccinations. I've also heard a lot of shout outs from Helping Hands of Vegas Valley with their volunteers being very helpful in getting individuals to and from. So a lot of this has been word of mouth collaboration, as I continue to say. I can't stress that. Platforms just like this, where individuals are coming together with the same cause, with the same barriers, just providing information to each other. That's been extremely helpful for our caregivers and our individuals that are receiving care to get the word out. And it's been very helpful in terms of helping individuals get to these vaccinations. So it's very important for us to continue these talks.
Well, thank you, David. We appreciate you being here with us today. Marcia, do we have any other questions, or should we move to our third poll question?
Yeah, before we do, I just want to let everyone know, in case you aren't aware of it, if you're interested in saving any of the information in the chat, you can save the entire chat file. And if you go to the area where you would type your message in, you'll see over to the right-hand side, there's an icon and the word file next to it. And next to that, in a gray outline box, are 3 dots. If you click on the 3 dots, it gives you the opportunity to save the chat. So I know there was a lot of really great resource information shared on here, and it might be great for you to save that so that you have it for future reference.
Marcia, this may sound like a stupid question, but it's saved, but how do I access it? Where is it saved to?
So as soon as we finish our meeting, when it ends, you'll actually have a file pop up, a window that will tell you, here's your chat, and you can save it on your hard drive or on your desktop.
Okay, well, thank you very much. I'm learning something new every day.
And I can put my phone down and stop screenshotting.
Well, great. No, I'm glad that's giving my brain a workout this morning, all these new things I'm trying to learn here. So, so thank you, everyone, being part of that. All right, so we do have a third poll question. So we invite you to, after we've seen this presentation, how do you feel? Are you more confident about making an appointment to get vaccinated, less confident, confused, no change in your confidence, or you're already vaccinated, or you do not plan to get vaccinated? Since this is our maiden voyage of our conversations with caregivers, we're trying to see if how the polls work and how people like them. So thank you for participating in them this morning. So let's see. I'm not seeing any changes. I'm assuming everybody has voted who wants to vote. Let's see, we've got 14% are is that very confident? More confident. We have 5, no change in your confidence. and 7 that are already vaccinated. So I
Mhm.
think we'll close the poll, but thank you for using the poll. This has helped for us to learn how to do all these features on our Zoom calls. And so next we do have a few minutes left before we have to end. If you would like, would you like to unmute yourselves, and we can just open this up to a general conversation. So anybody that would like to do that, feel free to unmute yourself at this point, and we will open it up to just general comments, other questions, whatever you'd like to do.
Aaliyah, David, maybe you can answer the question that sometimes is posed when people are not well and they're going to a vaccination site. Are they at greater risk? Is there something about the vaccines or the side effects that they need to wait until they're feeling better? Or is that just us feeling like, you know, we're dealing with enough things right now that we're going to wait until we're feeling better? The question is, if you never get feeling better, will you get vaccinated? So maybe the question should be, is there any risks of getting the vaccine when you're not well?
That's one that I'm not going to try to provide false information to. So maybe if Aaliyah might have anything on it.
Yeah, I know the recommendation is if you have like a flu or a cold or generally like unwell feeling the day, so you scheduled and it just happens that day you don't feel well, or you're scheduling it and you know you're sick. The recommendation is not to actually show up for your appointment that day, and that's just based on the guidance from the CDC specifically. And then at each vaccination event, they'll actually ask you if you feel unwell that day, and will make a recommendation to you regardless, if you don't feel well, to reschedule, make an appointment, just to make sure you can go home and rest. And then also just the risk of getting other patients who maybe they're ill or sick, if you have a cold and things like that. As far as it goes, I know one of the, I think, specific things you pointed out was if someone had surgery. I think I can't speak to this like specifically, just because I am not in the specifics particularly for that information, but I do know the broad recommendation is if you feel unwell, to rest, stay home, get better, and then once you're feeling well, and not unwell anymore, then to reschedule your appointment and then go in after.
Yeah, and I haven't been able to see any information in reference to like the side effects that could happen if you're sick already. I haven't read any articles or seen any information about it yet, at least.
Yeah,
I can jump in, and I'm not a physician, but I am a nurse and have a background in vaccination as an immunization nurse. And so just as an aside, usually the rationale for any vaccine for you to wait until you feel better is not because there's an inherent risk or harm that the vaccine will cause. It's that, as you mentioned, if you already don't feel well and now you introduce a vaccine into your body that it's going to respond to, you might have sort of not increased side effects, but you might feel more unwell than otherwise had you had waited. It's not that the vaccine will cause harm, it's that you might just feel even crummier if you're already having a bad day. If you're talking about chronic conditions that this person never feels great, then they need to talk to their doctor and say, am I good to get this? That's really always a number one go-to. If there's any questions, is that person should ask their primary care physician. So I hope that helps. And usually if people are recovering from something really acute, like an illness or a surgery, it'd be to wait till you feel well enough to get the vaccine. So that's just my 2 cents.
David, thank you for putting that in the chat. David put the respite care, Nevada Lifespan and Respite Care Coalition website. So thank you for doing that. It's a good addition.
Yes,
Any other
ma'am.
questions or comments anybody would like to make? Oh, David, go ahead. You
Oh
started.
no, I was just saying yes, ma'am. Being that we're here with a platform hosted by the Caregiver Coalition, I feel like it would go hand in hand, and I don't see a reason why we shouldn't be, collaborating on things like that, because we are addressing the same population, and we're running into a lot of the same barriers. So, if anybody would like to add the Caregiver Coalition's website, I'll appreciate that too, and I'll be exploring and becoming more active as well.
I wasn't paying attention to the time. Is it noon already?
Yes,
This
ma'am.
went faster than I thought. Sorry, I was going to let Aaliyah and David have a quick minute. Is there anything else you'd like to say before we're going to move to our conclusion pretty quickly here?
No, ma'am. Just as somebody said, stay persistent and patient, and we'll all be able to get to this vaccination.
Yeah, together we'll beat this, everybody. Well, I'd like to thank David and Aaliyah for being here today. We really appreciate all you're doing to fight against COVID. You've given us a lot to think about, and we appreciate you joining us this morning. I'd also like to thank Marcia O'Malley with Mindful Media Services for her technical assistance on our meeting today. We have a great committee working together on planning our upcoming Conversations with Caregivers, which is going to be a monthly occurrence. So I want to shout out to Lisa Davis for helping me in the planning of this session. Lisa works at Renowned Health. And also Cheryl Donnell, thank you. And she's with Nevada Aging and Disability Services Division. And Riley Franco, I don't think is on the call today, but she's with AARP. So that's our committee. We invite any of you to join us. And we're very pleased to announce our next Conversations with Caregivers will be April 19th at 1 p.m. So moving forward, all of our events will take place on the third Monday of the month at 1 p.m. We took a survey and that seemed to be what people responded to, wanting to have it Monday through Thursday and in the afternoon. So we will try that time and see if it works for people. But our next month, April's topic will be stress repressed, caregiver tips for everyday stress. I didn't think I was going to be able to get that out of my mouth, but anyway, we invite you to join us next month on the 19th. Hope to see you there. All attendees today are going to receive a follow-up email from our chair, Deanna Hearn. Thank you, Deanna, for doing that. So we can gather feedback on this series and also, again, suggestions for future conversations in this series. So I'd like to thank everyone for your attendance today. We look forward to seeing you in April. We hope you'll join us then. And goodbye and have a great day, everybody.